Hi, it's Doug Holland, LMT, with a massage tip for massage professionals. Today we're going to be discussing diabetic neuropathy and will reflexology massage help it? Because we get that question all the time. At least 5 or 6 phone calls a week we get here. People asking, is there going to be any kind of relief from their neuropathy? But first what we want to do is we want to discuss what the neuropathy is, especially diabetic. Not chemo related, but diabetic. Now, this condition is a result of high blood sugar for long sustained periods of time, which is hyperglycemia. So what happens is that when the sugar stays high in the blood, and especially in the lower vascular system and out most peripheral areas of the body, that sugar destroys the myelin sheath. That's the protective covering over the axon itself, the protoplasmic fiber of that. It destroys it, just almost like acid. If you put acid in your eyes, that would burn your eyes. Well, that's what sugar does to nerves. So as a reflexologist, a massage therapist, what we want to do is we want to bring fresh circulation into the feet. We want to open up articulation, and we're going to discuss, how we do that as we work on the feet so that we can get a better understanding. So I'm going to demonstrate how I do reflexology and massage on the bottom of the feet for those individuals that have diabetic neuropathy of the feet itself. Okay? So let's get down to the feet. Okay, so we're going to discuss how we can help somebody with diabetic neuropathy. Now we know there's 2 types of feelings that a person might come to you with. They might come to you with they don't have any feeling in their feet. They're numb. And if they're numb, wow, you can really hammer away at them. If they're super sensitive or to the point of where it's almost debilitating, then we're going to have to treat the foot a little bit different. We can't be as aggressive when we start. Now the first thing I'm going to look for is I'm going to look for any kind of black marks on these toes. If there's any black marks on these toes, you send them to the hospital immediately. You will be very, very surprised how many people come in with diabetic neuropathy and already having ulcers on the tops of their toes. And if you want to save them, get them out of here right away. But if they don't have any damage, it's just maybe there's blueness, grayness to the tips of their toes, because generally you're going to see it up here. This is where you're going to see the problems. It's going to be in the toes because that's the most distal aspect of the body. So I'm going to look at the approach from this. How much pain can that person take? If they do have, the neuropathy is causing them a painful sensation, or how much pressure I can use if they don't feel much. The only way to test that out is to grab the foot. So we're going to start. And this is how I usually grab the foot. I grab it like this, and I just do a small squeeze and see where they're at. If I squeeze that foot and they're like, oh, ow, something like that, then I know that they're on the super sensitive side. If I grab their foot and they don't do anything, then I say, all right, I'm able to start. So what I'm going to do is I'm going to rock the foot to get started. Just a nice little rocking. Kind of see where they're at to see if they have any kind of pain. If not, I'm going to move on to metatarsal wrenching. I'm going to wrench the foot just like this, sliding my hand up, twisting those metatarsal heads. By the way, in my book on Amazon, The Holland Method of Advanced Reflexology, a shameless plug, you can see exactly how to position these hands and how much pressure you should use. Okay, so back to this. I'm just opening it up. Now, if this causes them pain, it's going to tell me a lot. I'm going to have to back off, and I'm going to be doing a lot of superficial strokes with my fingers. If they can take this pretty easy, I'm going to move on to the next step, which is movement through the valleys distally of the metatarsal bones. So we know we have 5 metatarsal bones. So we take the hand and we want to go in between each and every metatarsal bone to drive nerve innervation and blood circulation and moving of lymph. So how I start is I get a hold of the foot up top here. I take my thumb and I look for that plantar pad where it ends and the soft tissue begins, and I start taking my thumb and I move up. Right now I'm moving on the medial side of the first metatarsal bone. and I'll work my way up until I reach here. Now I'm going to look for the valley between the first metatarsal bone and the second metatarsal bone. So now I'm going to go ahead and thumb walk using the pressure that they allowed me to use all the way up until I hit the hallux. And once I hit the hallux, which is the great toe, I'm going to work my way to the most distal aspect of this toe. Now by doing that, I'm ensuring that there's plenty of pressure up here to drive in fresh circulation and kind of drive out any kind of poor quality cellular issues that are there. And I'm going to repeat that through each of the valleys between the metatarsal bones up to each digit. So we work our way to digit number 2 and do the same thing. Work our way up to digit number 3, do the same thing. Work our way up to digit number 4 and 5, etc. So we're going up the valleys, we're working distally, and we're causing a lot of pressure to go up towards those tips to get out that sugar as quickly as possible. Then I'm going to work transversely. So I'm going to work my thumb across both ways through all this plantar fascia and soft tissue. And then I'm going to work the ridge itself in the opposite direction transversely, and we'll do the same thing. We're going to walk all the way down. I'm doing this quickly to save time, but I'm going to go all the way down and work my way to the very bottom again. Once I have established that I've worked a lot of this plantar, now the dorsal aspect, it's mostly, bones and ligaments and tendons. You don't really have any soft tissue up there to work. Most of it's going to be on the plantar surface, not on the dorsal surface. And so I'm going to spend most of my time in here on the lateral and medial sides of the foot, and of course near the Achilles tendon on the back side. And I'll make sure I go through the whole groove between the talus bone and the calcaneus also. I want to make sure that I'm working that area. But you can also work your way anteriorly down posteriorly. And so what I do is I take my thumb and I start at the top, and then I work my way down the hallux, and I go as far as my thumb will allow me to go, and then I stop there, and I do the same thing with each toe. I work down, and I work down like this. And so now we're working towards with the venous flow. We're working with the venous flow to drive out any issues that are in that inert tissue. Okay? And then I'll finish off with some nice metatarsal work just to kind of get the blood flowing, because that's what we want to do as massage therapists and reflexologists. I'm not even going to be paying attention to reflexes, by the way. I'm only going to be focused on the anatomical issues that are driving this problem. I'm going to be focused 100% on getting that sugar moving so that these nerves can start healing. And if that individual, that patient, tells you the next day that they were walking on a cloud and they had like a nice tingling sensation, then you know that your work is going to help them. And it should last between 2 and 3 days for them. If they go home that night and they're not seeing any success with that, it could be just a little bit too late for them. But as long as we see a couple of good days, 3 days of relief, then we know that we can help them. And of course, their responsibility is taking care of their diet and those kind of things that can improve better circulation. But from our aspect as massage therapists, that's how we can tackle it. Got to use common sense, how much pressure to use, how deep you can get into that tissue, and make them feel better. Anyways, if you enjoyed this video, guess I can show my face here. If you enjoyed this video, please hit like and subscribe, and we'll just keep pumping these babies out.